heart attacks, or myocardial infarctions are often perceived as an issue affecting only the elderly or those with obvious health problems, but in reality, they can strike suddenly and unpredictably, even in individuals who appear young and healthy. The underlying cause is a blockage in the coronary arteries, which supply oxygen-rich blood to the heart muscle. This blockage is typically the result of plaque buildup, made up of fat, cholesterol, and other substances, which can rupture and form a clot, cutting off circulation and leading to tissue death. Despite medical advancements, heart attacks remain one of the leading causes of death worldwide, and the number of cases among seemingly fit individuals continues to rise. One of the most alarming aspects of heart attacks is their increasing prevalence in younger populations. Traditionally, men over 45 and women over 55, especially postmenopausal, were considered the most at risk, but an increasing number of cases are now reported in people in their 30s and 40s. This trend is particularly concerning because many younger individuals do not recognize their vulnerability, leading them to ignore warning signs or fail to manage their risk factors. A family history of heart disease is one of the strongest predictors of a heart attack. If a close relative, such as a parent or sibling, has suffered from cardiovascular disease, the likelihood of developing similar issues is significantly higher. Genetic predisposition can contribute to high cholesterol, hypertension, and other conditions that set the stage for arterial blockages. Unfortunately, many people with a family history of heart disease do not take preventive measures early enough, assuming they are safe because they feel fine. Smoking is another major risk factor, even for those who appear otherwise healthy. Cigarette smoke contains chemicals that damage blood vessels, making them more prone to inflammation and plaque accumulation. Nicotine increases heart rate and blood pressure, placing additional strain on the cardiovascular system. Even secondhand smoke exposure has been linked to an elevated risk of heart disease. The misconception that occasional or light smoking is harmless further exacerbates the problem, as even small amounts contribute to long-term vascular damage. High blood pressure is often called the silent killer because it develops without noticeable symptoms until a crisis occurs. Uncontrolled hypertension forces the heart to work harder, thickening the heart muscle and narrowing arteries over time. Many people underestimate the importance of monitoring their blood pressure, particularly if they do not experience obvious discomfort. However, prolonged high blood pressure significantly increases the likelihood of a heart attack, especially when combined with other risk factors. Elevated cholesterol levels are another hidden danger. LDL cholesterol, often referred to as bad cholesterol, contributes to the formation of arterial plaques. While cholesterol problems are often associated with poor diet and obesity, they can also be influenced by genetics. Many individuals who appear fit may still have dangerously high cholesterol levels, making routine blood tests essential for early detection and intervention. Diabetes is a significant but frequently underestimated contributor to heart disease. High blood sugar levels damage blood vessels and nerves that control the heart, increasing the likelihood of blockages. Diabetics are not only more prone to heart attacks but also less likely to experience typical warning signs, meaning that by the time they seek medical help, the damage is often severe. Obesity, particularly excess abdominal fat, is strongly linked to cardiovascular disease. Excess weight strains the heart, raises blood pressure, and promotes inflammation, all of which contribute to a higher risk of heart attacks. However, even individuals who are not visibly overweight can have high levels of visceral fat stored around internal organs, which is especially harmful to heart health. Sedentary lifestyles are becoming more prevalent due to modern work environments and digital distractions. A lack of regular physical activity weakens the heart, reduces circulation efficiency, and contributes to weight gain, high cholesterol, and insulin resistance. Many people assume that occasional exercise is enough, but without consistency, the protective benefits of physical activity diminish. Chronic stress is another underestimated factor. Prolonged stress triggers the release of hormones like cortisol and adrenaline, which can elevate blood pressure and promote inflammation. People who frequently experience anxiety, anger, or work-related stress may unknowingly be placing their hearts under constant strain. Stress-induced heart attacks are particularly common in younger individuals who otherwise appear healthy. Alcohol and drug abuse, particularly stimulants like cocaine, have a direct and immediate impact on heart health. These substances can cause blood vessels to constrict, leading to sudden increases in blood pressure and heart rate. Even moderate alcohol consumption has been linked to heart disease in some individuals, contradicting the popular belief that only excessive drinking poses a risk. While men have historically been considered more susceptible to heart attacks at a younger age, postmenopausal women experience a sharp increase in risk. The decline in estrogen levels affects cholesterol balance and arterial flexibility, making women just as vulnerable as men in later years. Unfortunately, heart disease symptoms in women are often less recognized, leading to delays in diagnosis and treatment. The reality is that heart attacks do not discriminate. They can strike anyone, even those who consider themselves fit and healthy. Many victims experience little to no warning before their first cardiac event, making prevention and awareness crucial. Regular checkups, lifestyle modifications, and early intervention for known risk factors are the best defenses against this silent but deadly threat. Ignoring potential warning signs or assuming that youth and good physical appearance provide immunity can be a fatal mistake. 1/2